Hey, Brian.
What's
Good
up,
morning.
Doc? What's up? You gonna make me look beautiful?
I am.
Get rid
I am.
of some of these wrinkles, man.
Look at those creases, man. Those aren't wrinkles. Those are creases.
Those creases, they're back, man.
All right, we're gonna take care of you today. My assistant put our little numbing cream already. I'm gonna do a little map on your face.
All right.
And then we're gonna kind of figure out. I had a map from before. You know, I like to put the map wherever we're gonna inject the Botox, so we could create a pattern that we could repeat for future appointments. Okay.
Awesome.
All right, guys. As we could see with men, you know, we tend to have a lot heavier brows. And we certainly don't want, you know, a feminine look. We don't want a frozen look. We don't want the eyebrows to come up. So the pattern that I create with the Botox or Dysport treatment is really important, right? So that we don't get any of those negative results. So I'm going to have you lift your eyebrows for me. We see basically deep creases all the way across. Where we have to be really careful is right above the brow, not to inject 1 centimeter above the brow, because Botox and Dysport, remember, relaxes the muscle. So we don't want that muscle relaxed and the brow to drop and make the brow any heavier than it already is. So first thing I'm going to do is just draw a little map. Lift your eyebrows for me again. And make that expression in between your brows. This is that angry, pissed off look. Typically most people have like deep 11s. He's been treated before, so his 11s are pretty good. So 3 areas are in between the brows, the forehead, and then of course the crow's feet. Smile real big. So he's got, again, some deep crow's feet. Relax again. With the Botox, I could help the crow's feet a lot, but just limited to this area. If I see that the brows are really heavy or those crow's feet are too deep, the other thing we could do is add some filler in the temples. So a combination of filler plus Botox or Dysport around the eyes looks really nice to kind of like lift the brows. Turn your head this way a little bit and smile again. Relax. And obviously here when I'm injecting, I'm gonna try to avoid the blood vessels so we don't get any bruising as well.
Gosh.
Ready to go?
I'm ready, man. I'm ready.
Let's do this.
I'm gonna try not to flinch on camera. Listen, for all you guys out there, my side can get the hormones corrected. That from an anti-aging standpoint. This is to help the face.
That's it. We're gonna keep it looking young forever.
Let's hope so, man.
All right. So each dot here is an injection point. And depending on how strong those muscles are, I'm gonna customize the dose. So where each injection is anywhere between 2 to 4 units for most people. My assistant here is holding a little cool vibrating device, which works just to help alleviate the discomfort of the pinch. We prepared his face with a little anesthetic first, and the anesthetic that we use is a very strong topical cream called TAC, or triple anesthetic cream, and that cream penetrates the skin. We leave it on 10 to 15 minutes, and it makes the procedure very comfortable.
I really can't feel much.
Yeah.
That's great. Do I have to avoid the sun? Tell me the rules again.
Yeah. So 3 things we recommend not to do is no strenuous exercise, no direct sunlight, and no excessive alcohol. Most importantly, in the first 24 hours. Anything that's going to make the blood rush to your head is going to cause swelling, so we want all these little tiny bumps that he'll have for only about 10 minutes to go down. If he does any of those things, it's going to be more likely that you'll get some swelling in these areas. Also, you could wash your face, put moisturizer, sunscreen on. All of that is good. I'll clean his face up a little bit.
So I have a pool party tomorrow, by the way, for the Little Lighthouse Foundation. So should I put block on or try to stay in the shade?
No, by tomorrow you should be fine.
I'll be okay?
Yeah. It's really the most important time is 4 hours before and 4 hours after. But we recommend really no strenuous exercise and no direct sunlight for 24-hour period.
Okay, great.
All right. So this effect, this doesn't have an immediate effect like fillers do. He's going to see results anywhere from 3 to 7 days. So we usually tell patients to give it about a week before he sees the results. And then, if there's anything he doesn't like, if there's like maybe one wrinkle on one side and not the other, then he could always come back for a little touch-up. We change the little map, and then we try to be consistent for the next time. And that's it for the Botox or Dysport treatment for today.
Awesome, thank you. Only in Miami, by the way, can you go to a charity event in a pool.
Yeah, right.